Hello and welcome to a very special show here on East Mojo. I'm your host, Karma Paljor. The show is called Calling Home, and as the name of the show suggests, it is something to do with our people. Some very accomplished people who are away, who are working abroad, some are in India, and they are dialing in to tell us their story. And today, joining us are two incredible people, both of them Sikkimese, who've made their state proud. Ashila Wangdi, joining us all the way from England. She's one of the frontline COVID warriors, as they say these days. She works with the NHS and she's a clinical specialist. She's worked with stroke patients, but now, because of the virus, she's been thrust in the front line and she's been working every day at her hospital, which is the Middlesex University Hospital there in London. Our other accomplished guest is a person, a doctor, who kind of tries to understand the interactions between humans and computers. Dr. Naresh Agarwal, joining us all the way from Boston. There, he's the associate professor at the School of Library and Information Services at Simmons University. Thank you both for joining us here on East Mojo. It's a privilege to have you both talk to our people across the Northeast. Welcome.
Thank you, Karma.
Thank you.
I know this is a difficult time, and both Ashila and Naresh, have lost someone who's close to them in this pandemic. We will talk about that. But more, I thought that we will just step back a little and speak about their lives. Inject some positivity into the lives of youth of Northeast. So if you're listening in, if you're watching in, we will hear their story. Of course, we'll talk about how the world is going to live with COVID-19. But more importantly, understanding what they're doing right now. First to you, Naresh, how has it been, from a busy life of the university to be locked down? I just saw one of your Facebook updates. You had gone to your university and you were saying, not a lot of people. You had to shift rooms. How was it going back to the university?
When I went back now, it was surreal because it was empty, and we just had public services, and we had to take masks and sanitizers and stuff and gloves from there and go to our offices and pack, because we're reorganizing within the university as well. So that is going ahead. But otherwise, it's people are all at home. For me, it was not much of a change teaching-wise, because I was teaching 3 courses online this semester. And so that remained the same. I in fact got busier because the kids are at home and my wife was home for part of the time. She's back to work now. So there was a lot of Zoom calls through the day, and I was also assisting in my university. I was part of the COVID-19 preparedness task force for a little while when it all started, and then recorded some videos for other faculty who had not taught online to help them transition to online. But so yeah, things have gotten busier for me, but otherwise, I think it's more about not having the choice to go there. Typically, we would have weekly meetings where we wanted to gather every Wednesday, so those have all moved online. And there were certain faculty members who had never taught online or never been online. And for them, after 20 or 30 years, within a week to do that was a huge transition for everyone. And especially for the students, I think many of them come to the university for a face-to-face experience. And for them, not having that is a big deal. Actually, in fact, today is our commencement day. So students will be graduating. We would have a huge convocation ceremony and in a huge pavilion. And now they're all coming online on Zoom, like within groups of 10. That's going to happen after a call, after 2 or 3 hours. So it's different. And I think for graduating students, it's quite a big change. And they're not getting the kind of closure which they would get from a university education.
Right. Interesting picture that they're graduating and all of that is going to be on Zoom, online. Something maybe that we'll have to live with. And Ashila, you have a family, you have a small daughter, your husband is there, yet every day you're going to the hospital, you are seeing, and in the afternoon when we had a small chat, you were talking about how you lost a friend who worked with you in the same hospital.
Mm-hmm. Yeah, it's been a very difficult journey for the last 8 weeks. It's unprecedented. We've never seen anything like this. We were never prepared. We didn't have any dry runs or kind of drills to manage this. It has been very difficult. And talking about family and coming back to when you come back home, you want to leave what you see. I mean, it has been very challenging. We've seen like in a day about people dying. We've kind of had to really find new ways of working. We've been doing FaceTime to the families, which we haven't done. We never do things like that. You have one-to-one interactions with the families. So when you come back after a hard work like that and very challenging times, and then you have a little one of 5 and she doesn't really understand math, but to say like, don't touch mommy at all, mommy has to first wash up, don't cuddle mommy, you've got to sleep in a different room. It's all very, very difficult. And but children are very resilient. I don't know how they kind of manage and they understand, and she's been excellent. And yes, talking about my friend, very sadly we lost a very, very dear colleague of ours yesterday. And it's been like what, 2 weeks of the deadly virus, and we lost her. So yeah, it's been difficult times. Sorry.
I think I'm muted, Karma.
Yeah,
I think
I was muted. Thanks for that.
Yeah.
Okay, if you're joining us right now, then this is a two-way conversation. So yes, you can ask us questions. Do put your question on the comment below and tell us who it is for, and I'll read out that question to Dr. Naresh or Ashila for that matter, whoever it is for. So do write in. We'd appreciate you writing in with questions. Dr. Naresh, since you deal with a very interesting facet, I was looking at the book that you wrote or the kind of research that you do. You deeply delve into interactions between humans and computers, if I'm not wrong. That said, we've seen COVID has now made us comfortable with the way we are conversing, Before, interviews were conducted one-on-one with 2 cameras, 3 cameras. Today, we are comfortable talking thousands of miles away this way. Is this how life is going to be from here on? Do we have to learn to live this way? Families talking to each other on phone calls, video chats?
I hope not. I hope not forever. But yes, so my research area is more of interaction between humans and information. The computers happens to be there because a lot of the information we get now is via computers. So because I teach in what is called an I school or an information school, and that has been my research area. So it's interesting because I was one of the early adopters of online working. I've published 14 research articles with a collaborator from Bangladesh who was doing his PhD in Japan, and we interacted over 5 years, and we never met. Like, we met after 3 or 4 years, and we had co-written articles and had lots of weekly meetings and all that. So I've been working in this mode for a long time on GoToMeeting and later Zoom. But now I find that suddenly that shift of everyone moving to it, and I do not enjoy it anymore, not as much as that chance of having a face-to-face interaction, because I think seeing people in person and then shaking hands or hugging, all of those are important parts. Touch is an important part of our lives. And so much of that is gone. Like, we had our neighbors who were visiting India for 3 weeks, and they got back, I remember, on March 8th. And suddenly by the time the COVID thing was coming in, and then we never really met in person, or really, it was like always from a distance of 6 feet and more since then. And so in a way, I like the fact that we had this comfort level with technology, so universities could also move like within a week or two into this whole transition online, and schools moved in pretty quickly as well. So there was little disruption because of the infrastructure that had been built on. And also the other good part is that even though this started in China and then moved on to other parts of the world, the information about the right protocols, hand washing and social distancing and all of that, that kind of knowledge also spread quickly. Otherwise, a lot more lives probably could have been lost if people did not know how to handle it. But otherwise, I hope we can go back to a norm where we are able to meet people more often as well. And the studio setup that you're talking about, Karma, I hope that gets back as well. But how long, we never know. I think it's at least 6 months to a year. Could be easily be there. 2020 for sure. I think we are already thinking of scenarios of a fully online fall semester or some mix of getting a few people face to face. There are many scenarios which are playing out in universities. But yes, I hope we do move to at least some form. Though some people are saying that we have to learn to live with the virus as well, like other viruses which we like HIV and other viruses that we have learned to live with in different ways, and which keep coming.
Right. Praveen Yadav has written in saying that, how will rural hilly states of India cope with this COVID shift of digital technology as a daily normal? It's an interesting question. Again, I come back to you, Naresh, because while we are privileged in the cities, US, of course, is highly connected on the internet. The reality is in our villages of Northeast India, where we come from, internet penetration is not that big. So a lot of our children are missing out on their syllabus, are missing out on their studies, because simply there's no way apart from radio or a television to show, and the poor people don't even have that.
Yes, I think there are two issues. One is an issue of digital divide that you're talking about, where people do not have access. So that I think for those people, it's important for us to provide various ways of access. I was the co-editor of a journal article on low-tech, how we can make things available in a low-tech environment rather than high-tech. So in a lot of Southeast Asian countries, lack of access to technology is a big issue. On the other hand, for people who have been very connected and day in and day out, people in the cities and countries which have high-speed internet, I think this is a chance to unplug. It is a chance to go back to that times of our childhood. Karma, you remember growing up in Gangtok, where we were not connected with technology. We were fine. We were happy, and we were going on to TNA, Tashinamgal Academy School at Tibet Road, and all of those normal lifestyle that we had. And we had friends that we saw face to face, and other people who we met once a year or once in 2 years, like other families. So we met people when they physically visited us. So it's a mix of those different times. I think it is about. And you mentioned my book. So my book was on context and information behavior. So I feel that everything is based on context. There is no single scenario whereby we can apply it universally to everyone. How this disease affects every person, every family, every town, village, every city, every country, I think it's all very different. It's about who is looking at it and from whose point of view. So there, I think we'll have thousands and thousands or millions of stories coming out. And our challenge is how to help each one of them in the unique ways that they need help, rather than trying to provide a solution that works for everyone, or that we would say that would apply to everyone.
Right. If you're joining us right now, you're with East Mojo on a show we've just started called Calling Home. And this show is all about connecting our accomplished diaspora, hearing their stories from where they are. Right now, we have Dr. Naresh Agarwal, who is from Simmons University. And we also have Ashila Wangdi, who works with the NHS, who's a clinical specialist in London. Ashila, let's now shift our discussion to something different. Let's talk about your journey. I know you've had to struggle to reach where you are, but tell our viewers, especially the youth, who want to know about how you've reached and how you've reached where you are as a clinical specialist in the NHS. I know it's going to take a long time, but in short, how was your journey? What did you have to do?
Well, I mean, I grew up in Gangtok, in Arikang. I came from a small town. I think I always had big dreams. I wanted to achieve. I wanted to see the world. I wanted to explore different horizons. So that was always there. And I had very pushy parents as well, who wanted me to do well and achieve. So I think it was a combination of, me wanting to do, as well as a support from the family and, the extended family as well. So yeah, I did my schooling in Holy Cross in Gangtok. Then I moved to Ajmer. Then I went to Bangalore. From Bangalore, I came back to Sikkim, worked a little while in Manipal, then worked in STNM. Then I decided that I probably need to specialize into something called as neuro rehab, which is something relatively new at the time. And I kind of got a scholarship and came over to UK, to Kiel University, and the journey began there. So it's been a good journey, struggles as well. But I think for the youth of Sikkim and the Northeast, I think the message would, if I can do it, anyone can do it. It's not difficult, and I don't think that I've achieved something great. But of course, from it's something that if you want to do something, you can. I guess that's the message.
Yeah, and one thing Ashila keeps doing is talking to youngsters back home, answering their queries if they want to get to, if they're in the medical profession, if they want to go to the UK, what to do. So she's been helping those kids with that. So that's one of the things that Ashila keeps doing. Of course, when we look at Dr. Naresh, it's very odd to call him Dr. Naresh because I've always called him Naresh, and we were like, one class apart. Now, he was one of the superstars of our school, and I think one of the toppers in the state, or I think across the region, or I think something more than that. It's been 25 years, so I don't recall so much. And you got 100% scholarship, Naresh, to the Nanyang Technological University, Singapore, if I'm pronouncing it right, isn't it?
Yes, yeah. And I did, Karma, yeah.
Tell us a bit about your journey.
So I think, yes, my journey, I think the first part of my journey, Karma, has been with you, right, in TNA. I think there itself, I can't, when I look back now, I think there were a lot of privileges. The fact that we could go to the best school in Sikkim growing up, and that I see as a big privilege, which I think prepared us in a lot of ways to face the world ahead. We had access to the best teachers, the best of education at that point, and I got a lot of support from home because I was the youngest, and I think one of the things which was there growing up in school was just living up to the expectations of teachers and siblings and parents. I think so. That part was there, and I just happened to get the scholarship to go to Singapore. I had to sit for 2 tests in Calcutta. There was a friend of mine, Siddhartha Kotwal, is in Germany now. So he encouraged me to apply for the scholarship. My brother got a book from the community center library, and it was about scholarships and studies in India and abroad. And I applied for it, and Siddhartha told me that if anyone can get it, you would get it. And that was right before before ISC. So I just applied for it and forgot about it. And later the call came for an interview. And even when I went for the interview, there were so many smart people gathered in Taj Bengal in Kolkata. And I looked at all of them, I spoke to them, and I felt that there's no way I'm going to make this. But I just went in there and did my best and gave the interview and sat for the test and came out and came back. But later, I realized that from all those, the number of 30 to 50 people that I met in that room, not a single one of them was in Singapore. And all the other people who made it was later. So that I tell that part was because we doubt ourselves a lot, especially when we compare ourselves to other people. And I think it's important for us to realize that each of our journeys in this life, right, is an individual journey. We might be born in different families, in different households, and in different places, but we really have to think what we want to do in our lives and how do we want to spend our days that we're alive. Because even though this COVID situation is teaching us that everybody is going to die or people are dying in different ways, but we are alive while we are alive. So we do ourselves a disservice when we think of other people or where they have gotten. We really have to think of our own journeys as to what we do our lives. And I think somehow I had that in the sense that I didn't have so much of this comparison with me. I think it was always about trying to do what I wanted to do. So that helped. And Singapore, in NTU, the Nanyang Technological University, it was a great 4 years. It was different for me in the sense that in Sikkim I was sort of that best student in school. So I didn't have to compete much. I just had to be myself. And in Singapore, I didn't compete there as well, but there it was filled with people who had been toppers in the States and in a CBSE board. Not somebody who was there with like #2 of CBSE all over India. People who had gotten into IITs, ranked number 51, and it was all the stars from. There were 20 of them in computer engineering who had landed in NTU, and another 30 in NUS, the National University of Singapore. So that was a whole transition period where I went from being the best to being average in Singapore, because everybody was the best. But for me, it was important to enjoy the university education, which I did. And later on, I think after 6 years of working as a software engineer, I decided to go back to the university, and that's when I went to do my PhD at the National University of Singapore. And after the PhD, then of course I became a professor and then moved to the US, because my wife, she's a physician, Dr. Ashila Agarwal, and she is just finishing her cancer fellowship at Harvard Hospital, Dana-Farber, and St. Elizabeth Medical Center in Boston. And so some part of her journey has been intertwined since the time we got married in 2003. So she moved to the US, and that's why I had to move to the US because she didn't get a job as a doctor in India, because that time Singapore didn't recognize Indian medical degrees. So coming back to the US, it's been great. And for the last 11 years now, I've been with Simmons University. I often describe it as the happiest place on earth, but I think I have been lucky in the sense that Sikkim can also be called the happiest place on earth. And so I have been, and the town I stay in right now, Sharon, Massachusetts, is also very tiny, the small town, and it reminds me a lot of Gangtok and Darjeeling and that area and parts of Sikkim and a region of the northeast. So I think I have been lucky that way, that I've been able to live with and work with great people all throughout, I think, right since my childhood. So I do consider myself very privileged in a lot of ways.
Right. And Ashila, Dr. Naresh is kind of talking about his passion, kind of talking about finding your calling, being confident about and basically believing in who you are, a small town boy, going to Calcutta, getting slightly intimidated, by all the others who he thought were, better. But then he found his calling. And for you, it's been a similar story of finding passion, finding what you truly love from inside, isn't it?
Yeah, I mean, I suppose that's one thing, that I hold quite close to myself. I've not been one of the most intelligent person, or I'm not the school topper or anything like that. But what I have always been is I've been hardworking, and I've always wanted to excel in whatever I did. So, in terms of calling as well, I miss home. Sikkim is always very, very close to heart, and I've always wanted to do something. And we were talking yesterday with my consultants within the NHS, because I think this COVID situation has kind of suddenly woken, many people. We probably were in this rat race, and suddenly people have kind of got up and thought, we've got to do something meaningful in life. So we were discussing yesterday with my NHS colleagues, my consultants. So we're thinking, what should we do that probably would be meaningful? So we suggested whether we should start camps in India, whether we should go to, to Sikkim to organize some camps. So as far as, it's I think this whole situation has suddenly made people realize that life is not just about, kind of achieving things and, kind of going through the materialistic, kind of process, but also probably kind of trying to do something meaningful. I don't know what that would be, but probably, it's time. It's time to introspect and start thinking about things that would probably make, more of a importance to your life.
Right. If you're joining us right now here on East Mojo, you're listening and watching a show called Calling Home, which we've just launched. And Calling Home is all about speaking to our incredible diaspora from across the world who've got incredible stories. And joining us today on this talk is Dr. Naresh Agarwal from Simmons University in Boston, and Ashila Wangdi from London. She works with the NHS in one of the frontline COVID warriors right now. Dr. Naresh, would you want to go back to Sikkim one day?
Yes, I think I'm not sure about permanently going back because I did. I remember in my interview for SIA, the annual, the Singapore Airlines interview, and I told them that I see myself coming back to Sikkim and doing more for people of my state. But now I feel that the idea of going back and the idea of home has become slightly different in the sense that I am in a job whereby I teach, like I'm in a 10-month contract as a faculty member, as a tenured faculty member at Simmons. So there are, like, my semester is just getting over now in May, and then the new semester will start from September. In between, I'm teaching online in the fall, in the summer, but that's optional. So I could very easily see myself going back for 3 months in a year to Sikkim, and then coming back and working for 9 months in the US. So I think there could be a very healthy mix of the both worlds. It does not have to be either or anymore, I feel, in terms of.
So what will you do in that 3 months? How will you help the state?
I think there's a lot. There are things to do with. I keep asking myself that question as to what can I do and what can I do more. I think, and some of it has already been going on now. I just joined a group called Anthem, which was started by Sanjay Shetty, and he's a bodybuilder and he runs gyms across Sikkim, and he has been I think right now he's working on trying to get people who are stranded in different parts of India trying to get back to Sikkim, and in other ways. There are lots of things to be done. One of it is through talks, and like when I go back, typically I'm invited either in TNA or in some of the schools, and I talk to students. I think I could do more there, but also in terms of working with people who need help. I think I find it difficult to sort of separate one specific activity. I think being useful is a daily job, and it's a full-time job. So which means that no matter where you are, whether I am at home and doing dishes or playing with kids or changing diapers or at Simmons when I'm called to record videos to help other faculty members, or I'm in Sikkim talking to people in whichever ways I can help. Sometimes it can be with things like how to teach online. Otherwise, in terms of how to get to the US or in how to get to certain professions, there are a whole lot of ways, both financially as well as physically, I think that you can be useful all throughout. So I see, now I do not tie myself to a specific person or a group or place anymore so much. I see it just as a constant effort in terms of trying to be useful every single day, no matter what you're doing and no matter where you are, and no matter to whom. Yeah.
And Ashila, you want to go back? If you ever go back, what would you like to do?
Well, I mean, I think there are quite a lot of things, but I think I want to do something in health. I think in Sikkim, probably, health is something that I've got relatives, and they've always kind of running to Siliguri, finding like all. So I think I would like to do something in health, kind of see what I could do, kind of bring, how a health sector is managed here, to take it there and see if something like that could be done. But I don't really know what exactly, but probably something down the lines.
And I have some insight on this, Karma. Even in this question of doing, right, I'm actually more drawn to this idea of non-doing. which is in I was reading this book, Tao Te Ching, and there's an English translation of it by Stephen Mitchell, and it is this idea, I think, a very Buddhist idea of let things settle down. When we throw something in water and we think that the water will move or something will happen on its own, but if we just step back, things will take care of themselves to a large extent. And I feel that there's this whole big push about productivity and doing things all the time. And in terms of doing things, what are we really doing? We are always talking about cutting more of the roads and destroying more trees and building more things, or even when we, like all the infrastructure that we build, right? We are really, while we are trying to help, we are also harming at the same time. So I feel that a lot of it has to be like Sikkim itself. I think Sikkim is a very beautiful place, and it has a lot of the ingredients that is good for Sikkim on its own. So if you leave it alone, right, I think we are helping it to a large extent. That's one. But the health sector that you talked about, actually, I think that is a huge concern for people in Gangtok and other parts of Sikkim, as well as Kalimpong, Darjeeling, that our entire region, because people have to run to Siliguri, as you say, all the time. And now we have a new hospital, the new STNM, as we call it, that has come up. I think what we need to do is to create an infrastructure where we are able to attract the best of doctors to come from different parts of India, different parts of the world, and work with people there. And I think even if they're not able to physically move there, there could be a very smart system of telehealth that could be managed, whereby the machines are there, and maybe even if people are not physically there, we could have a system whereby people like yourself, people like my wife, they could give part of the time in terms of consulting or helping people and to bringing the know-how, I think, to that state. So I teach a course called Knowledge Management, which is all about knowledge sharing. So I think it is about how to develop an infrastructure where we create a database of who knows what at what points in time and what questions can be answered by who. If we can create that network, then I think we will know who to reach out to at different points in time. But I think for that, we have to transition from this mentality of us versus them a lot and get back to getting this knowledge from whosoever it's coming from, wherever people are. And I think once that happens, right, we can really help each other a lot. And health, I agree, actually, that is a huge priority. And the other part is about uplifting those people who do not have the basics, like what Karma was earlier alluding to, people in the villages and smaller towns who do not have the basic technology infrastructure, how to bridge that digital divide, I think. So there are lots of Indias and lots of Sikkims and lots of Northeast cycles, depending on who we're talking to. And how do we reach out to those different people and help people who want to help? So I think it's all about partnering with people on the ground and then trying to provide that knowledge that we can. Like now I know there's a push about smart cities going on, and I worry about things like that. I worry about things like smart cities, because if smart cities means installing CCTV cameras everywhere, then are we really talking about privacy implications of those? So every time when something is done, I think of what would happen if you don't do it, like the good side and the bad side of every step that we take.
Right, certainly. So it's important to ponder, sit back and think, now that you talk about infrastructure and how at times it's also important to just stand 2 steps back and do nothing and to just understand. And I guess that's what happened with Sikkim, with all the dams that we are building, with all the infrastructure that we are building. We did not take time to take 2 steps back, because both sides, one side which was opposed to, one side which wanted those to come up, was so at loggerheads that both those sides did not come back and take 2 steps back and look at what were the implications. And if they had looked at those implications, perhaps things would have been different. Ashila, interesting thing that Naresh talked about, of now in this world, one being, of course, you can spend time in US, you can spend some time in physically, that's physically. Even if it's not physical, we have some startup companies in India now doing telemedicine, and they are doing excellent job. They've got good basic hospitals, and they are joined by the best of doctors from across India. So they are doing an excellent job, but they need the numbers. So I guess they've not started that in Sikkim. Now, this is a possibility. We can have experts, clinical experts like yourself, talk to and have doctors in Sikkim and take a look at patients. That is a possibility.
Yeah, I mean, to be honest, I do a bit of that. I mean, not at a scale of, telemedicine or telehealth, but, my husband comes from Sombare in West Sikkim, and Sombare is quite a remote area, and you don't really have access to health. So my mother-in-law, before the lockdown, before all this COVID happened, she used to get quite a few patients lined up in the mornings, so at home. So we used to do FaceTime. And it used to be like, oh, I've got pain here and I've got this and that. So been doing like in a very small way, which I mean, it's possible. Like, she used to kind of just put her iPhone on, and then she used to have the villagers there, and they would tell me of their symptoms. We would say, if I needed anybody else specialist, I would connect them to the specialist. So it is very much possible. I think it's actually that this is the way forward. And in today's day and age, I think telehealth, telemedicine is it's a big thing. We're doing that anyway here with COVID right now, and I don't see why we can't do this, in future.
Right. And again, Praveen Yadav is very active. He's written in again. And this question, I guess, is to you, Ashila. You've worked in the healthcare sector in Sikkim as well. Why is healthcare the most neglected sector in the northeastern states? True, because thousands of people go to Mumbai, Delhi, everywhere to get treatment. And how can more youngsters be motivated to pursue the healthcare profession?
Well, I think a large part of it is how we are managing our health system. I mean, the difference I see is the management. There's a lot of emphasis here on training, on career development, on continuous professional development. Healthcare professionals are continuously developing themselves, doing a lot of work. If you could attract, like Naresh just said, you need to attract the best of the best people. How are you going to attract? How are you going to recruit the best people? How are you going to retain those best people? And that's a lot to do with management. And what are you exposing? Where is your career progressing? So I think in Northeast, it's very, I mean, I can only speak for Sikkim and I can speak for Gangtok, but there isn't a lot. You reach a certain glass ceiling, and from then on, there is no... With development, I don't mean like financial development. I mean like, your own personal growth, your career growth. Where do you go from there? So I think for our youngsters, probably if there was a structure put in place where they could go into different specialities, they could do different things. I'm sure, and like I said, it's a matter of recruiting the best and retaining the best as well. So I don't know if I've answered your question, but I think that's where we're going wrong. I think it's
right.
all about...
Right. And Naresh, is it all about, again, having, more and more universities, again, building one, university after another, medical university after another, and see this mushrooming thing happening, and we get lots of youngsters turn doctors? And does that solve our medical, problems in the Northeast?
I think one is about creating doctors, and one is about creating the quality of doctors. Because I remember when my wife had an MBBS from Calcutta, and she came to the US, and she'd started preparing for US medical licensing exams and all that. And the training that she went through, she said there's a huge, huge difference in the training that she got in India, which prepared her and made her into a doctor, versus the training that she got here. Because a lot of the medical training in India was based upon memorizing and remembering a lot of things. And it was all about a lot of training that you got from books. And of course, later on, with the volume of patients you saw, you got a lot of things. But here, right from day one, it was about applied scenarios. It was not about memorizing at all. Memorizing was kind of understood as a very basic base level. It was an application-based learning right from the beginning. And the other, again, part comes here based on privilege, because here the doctors have access to something called UpToDate, which is like a database of the latest medical developments which happened in the past 3 months. So within 3 months, whatever is the latest medication, they get it. So even now, when my wife gets calls for cancer treatments from different people in India, and people will come telling her that so and so doctor prescribed this medicine for this, and then she would say that no, this was just not advised to use 2 years ago. And doctors there are still prescribing it or giving that treatment. So there's a huge gap between what people know now versus what gets implemented over there. So I think I'm not sure if the volume will solve it in terms of having more and more doctors. Which of course that is a gap. There's a gap between the number of people we have as well as the number of doctors we have. That is hugely inadequate. But even if the doctors are there, if you do not have the infrastructure, whereby if you do not have access to all the machines that are required, all the medications that are required at a rate at which people can afford it. I think all of those are big gaps. And how do we bridge that gap and make sort of healthcare universal, and also provide healthcare with dignity? I think we have to think of the dignity of people who are that individual. I think right now, one of the things I find is that there is not enough of human dignity that we accord to people in terms of the lives, and thinking that people need the very, very basic things. So I think we have to find local solutions to our problems. Like here we have something called 911, where every time anybody in the US, wherever they have any heart attack or any kind of things, they can call that 911 within 5 minutes. Three types of vehicles come in. You have the police, you have the fire, and you have ambulance. All of those show up pretty much within 5 minutes to your doorstep, and lots of lives can get saved from their home on the way until you get to the hospital. And I think we've all either been with families or known people who have lost lives because they did not get the medical attention on time. And I think even if we can create a basic service like that, let's say in Gangtok, like I think in Delhi, what they have done with Mohalla clinics, if we can replicate that kind of a scenario somewhere in northeastern parts where we have, let's say something in MG Marg and different places where within 5 minutes you get life-saving help. Like even things like aspirin, right? Somebody is getting a heart attack or a stroke. Like I think, Ashila, you would have all the defibrillators and all of those kinds of very basic life-saving things, providing people with training on first aid, and say I think there's a whole lot of low-tech solutions I think we'll need to find in terms of training people in the market to save other people in terms of lives. And then I'm not sure how much high-end infrastructure we can create, but we should certainly have more than what we have right now. At least the kind of big hospitals, which even Siliguri has, those kinds of hospitals need to be in maybe in Gangtok, in Guwahati, and different parts of the major cities in the northeast, so that we do not really have to run to the plains for every simple need.
Right. Aparna is writing in. Ashila, Aparna wants to know what is the learning from US and UK that you'd like to share, particularly on preparedness for the worst case scenario of the long-term effect of COVID-19?
Well, long-term effect of COVID-19, I mean, it depends what we're talking about. Like, see, I mean, if technically, very medically, if I go, I mean, we had a lot of patients with comorbidities like diabetes and hypertension, ischemic heart diseases. They were the ones who had to go into ITUs. Now, if you are lucky enough to be stepped down from ITU, there will be a lot of long-term health effects in terms of scarring of the lungs you might have, and a lot of mental health issues. I mean, forget about the patients. I mean, healthcare professionals like ourselves, we probably will be kind of having to deal with a lot of mental health. So I think long term, it would be quite a lot of different things. But I think that the most important thing would be to focus on mental health. Mental health probably is going to be, a lot of people will be suffering from post-traumatic stress disorders.
Right. Anamik Guha is also watching, for your information, Naresh. So we say hi to Anamik. Yeah.
Hi, Anamik.
Subarna is writing in. This is a question for you, Naresh. As an educator, what are some permanent changes you see happening in the education system because of COVID-19? Are you certain practices that you think are there certain practices that you think will take to our post-COVID worlds?
Yes, I think one of the things which a lot of the faculty members who had never taught online had to do was brace and get used to teaching online. I think that was one step. Also, students who had never wanted to take online classes have also had to take those online classes and gotten used to the idea. So that is there. And I do hope that we will create a kinder, better world in terms of education as well, and overall in our lives, whereby we are able to take a step back and not get into this mad rush. I think, because even as an educator, I had started doing things like stepping back a lot. I think in terms of we are creating strategic learners who are really learning quickly and who are able to get A's all the time. And I remember there's this person who wrote 2 books on teaching and learning, how to be best college teachers and how to be best college students, Ken Bain. And I attended one of his talks, and he talked about, are we really creating deep learners? Are we creating strategic learners versus deep learners? And in my syllabus and the way I teach, I really try to step back all the time and try to look for ways in which students are able to reflect more and sort of try to find the journeys more rather than just having a lot of busy work all the time. So I think the post-COVID world will teach people some of those skills. So this is my son who has just walked in. Yeah. He's 5 years old. His name is Ishan. Yeah. So I think the changes will be there. For now, what we're thinking of is like, how do we go back in the fall? In September when we start, do we have? Sorry. Yeah.
That's all right.
Yeah. So there's a whole lot of scenarios of. I think right now the major challenge is about whether and how soon we can resume our normal lives in terms of teaching online, teaching face to face, and what kind of social distancing will need to be maintained if that has to happen. Yeah, that's my son and daughter talking over my phone and iPad now. Yeah.
Ashila, we had you earlier in our, one of our shows that you came in and you spoke about the challenges because you were watching what people in Sikkim were doing, and you were panicking at that point. You clearly panicked and you said, you shouldn't do this. Has your thinking then changed to what has happened today? Have you changed something?
I mean, I just must congratulate Sikkim. I mean, I think it is it's God's grace or people's discipline that we've not had a single COVID case. And I was very, very worried initially when this all started, and I was kind of thinking, like, if countries like UK with the best ITU facilities, with the best medical facilities could succumb to 30,000 deaths, what would happen if if it would come to Sikkim? But surprisingly enough, I think I'm much more calmer. It feels like, I've got faith in people of Sikkim and the government of Sikkim to do the right thing. So it feels like it's kind of going the right way now. However, since the stranded people have come in and the quarantine facilities, I've been hearing, I don't know if it's truth or not, but I've been hearing that, people have kind of had negative, test results, and now they've kind of moved to home quarantine. Now, my only problem with this home quarantine was it is fine as long as the entire household is being quarantined and not just the person who's traveled. Because, there is a whole thing about being asymptomatic and then kind of getting the symptoms in the 14 days and running up to 21 days, depending on how many people are in the household. So, I mean, I'm just hoping and praying that, people are intelligent enough and people are doing the right thing. So, no, I'm not as worried as I was earlier. Certainly not.
Right. And of course, to our aid, low tech or no tech has also worked for Sikkim and the northeastern states. And there's an interesting story. If you go to eastmojo.com, one of the stories that we filed yesterday is about 3 villages in remote parts of in Manipur, in Senapati district and Ukrul, at a time when people in the metros are discriminating against, people who have COVID, or discriminating against even healthcare workers because they are so scared. The villagers of there have built lovely quarantine centers made of bamboo and locally accessed materials, and they've provided running water, clean water. There's a stove apparently in each room with little utensils to cook food, ration, and they are ready to welcome their brethren from across India who are coming back now, because some of them have lost jobs, some of them don't want to stay in the city. So these are like, little village movements which make people smile, which makes us happy, that sometimes low tech is the best tech, and you don't need so much to think. Again, a question for you from Anamik Guha. Hi, Naresh. What do you think about the way India is dealing with the situation in India, and how different is it from US?
Yeah, I think it is different from the US in different ways. There are different differences in terms of medical infrastructure, the money access, as also the politics are different in certain ways. But I think India got lucky in certain ways, in the sense that I think the virus was about 2 or 3 weeks late, or more than that, than what when it came to the US to that same extent. So we got a little bit of time. I was initially very worried as well, and I was creating those videos about why the social distancing and all that. I was really trying to get people to have the quarantine. But when the national lockdown started, when we had that 21-day lockdown, that really helped a lot. And I think now I'm, as with Ashila, I'm not that worried, but I'm worried about a second wave and people being complacent, because I was seeing this example of a watermelon. It says that watermelon is green, but as soon as you cut it, it turns into a red zone, right? So green. So it's like it is good initially, and then I think we have to keep our vigilance aside. In terms of dealing, as I agree with Ashila, I think we have done very well for Sikkim, and to keep it COVID free until now, I see it's a huge accomplishment for our state. We just have to make sure that we continue to do that. At the same time, not if we do get a case, I think it's only a matter of time when that happens. When we do get a case, is in order finding ways to deal with that in the right possible manner. I'm actually very worried about older people, including my parents, like who are 75 and 83. My mom is 75, my dad is 83. And here also, I'm very worried about my wife and myself, because we are all vulnerable in different ways. But I think, and I just lost a very good student of mine to COVID. So the threats are real. I want people not to panic, but at the same time, take the threats seriously. And not I think stop with the very basic things of washing hands, the social distancing, and all that. I think those things we cannot let down. And at the same time, we even as we open up, we have to keep our vigilance aside, I think, and not panic, but at the same time continue to be cautious.
Right. Which one of your kids was crying?
That was Ishan, and then Isha just came down and she's trying to show me messages on the iPad, which I cannot read right now.
Okay. Is he all right?
He's fine. No, he's fine, because my daughter is 6 years older to him, like my own older sister was. So she is very motherly as well. So she can handle a lot of things.
Ah, you're lucky. You're very smart. Nice planning, yeah.
Yes.
Well done. Nice planning, both of you. I guess two doctors in the same house helps, na? Because we calculate like this, na? Okay. I'm going to have my first child. When the first child is ready to take care of the other one, we have the other child, yeah. So when is the third one? When Ishan?
The third one is not in the line, but I think we just got lucky. Initially, we thought we'll just have one child, and we were very happy with Isha for many years, until we started realizing that she was getting a little lonely and not and then we felt it, because we both, my wife and I, we both had siblings at home, and we felt that okay, she needs someone at home rather than just waiting for a play date with another friend. And that was how we thought of a second one at that stage. But otherwise, we were initially very happy with the daughter for many years.
Sange Pema has got a very interesting question for both of you. I know the answer for Ashila. So Sange Pema is writing, what do you both miss the most about Sikkim? Ashila, it is kinema and shuguti masa, no? I knew. That was the smelly one, no?
No, not kinema, certainly. What do I miss? Pretty much everything. I think it's just it's something about being home. I mean, I miss my roots. I miss my family. I don't know. It just it's a happy place. It makes me happy. But I don't think I can live there now. It's been quite a while that I've moved. But yeah, it's my happy place. Whenever I go there, I just feel happy.
Okay.
So I miss pretty much everything.
Yeah, Ashila's husband and I have played a couple of good pranks on her also.
Oh yes, of course.
Saved for later. Naresh, what do you miss the most?
Chirpi.
Oh my God! Is that about that the wedding night? Oh no! Or is this about what was it that you did?
We
What-
were-
That you did something really silly. I remember that the two of you, because you wanted to go drink, and then you kind of told me that an entourage was sent by the chief minister or something like that to bring me down, and you had to kind of take me. And I think it was all planned. I don't remember the ins and outs, but they've done something really, really silly pranks on me. And I'm just, you can see how gullible
Yeah.
I am. Just fall
Wait.
into it.
I didn't say anything. I was not going to say it. That was sort of private.
But then you've done like really funny
But-
things.
The question now is to Naresh. Pass on. He misses Churpi. Other than Churpi, what do you miss?
About Sikkim, I think I miss I miss the simplicity of our lives in Sikkim. I think people are all very simple and nice and laid back. I miss that laid backness that we have over there. Though I try to create that for myself in a lot of ways in terms of working hard and then stepping back, that sort of thing. But I think overall people have that. I think we are from that region where people are generally very happy. I think happy and satisfied, and they're not there to compete or to pull other people down. I think I don't see that in our people at all. And I think I miss that when I see that in Sikkim. To some extent, I find that in the US as well, where people are kind of okay being themselves, but people in Sikkim are also okay being themselves.
I don't know. We could argue on that, but we leave it for a separate day. I'll pass this question now to okay. Okay, Anamik is saying thank you, Naresh. We've had wonderful. And Anand Pradhan is also now watching. Hi, Anand. We'll ask. There's one question for you. Even after being so rich from all corners, why is USA and UK having so much of casualties in COVID-19? What is your take on Northeast, Ashila?
Sorry, repeat that question again. You were breaking.
Despite being so rich, countries like US and regions like Europe, why are there so many casualties in COVID-19?
I think it was just kind of being a little bit complacent. I think if we had had a lockdown few weeks ago, probably it wouldn't have been like this. It's either being complacent or being overconfident. I don't know, one of the twos. But I think we were a little late. I mean, when China had it, Italy had it, we had enough time to prepare, and I don't think we were prepared enough. Probably we didn't think it's going to hit us this bad, but I think it was a mixture of being complacent or being overconfident.
Right. Naresh, why do you think it happened? Because we still see people going to the beaches, people going out, and they're like pickets and shouting against the lockdown, strike against lockdown, and all kinds of things going on in the US.
So I was watching I was reading a Facebook post yesterday, which was about a person who said that the person feeling really bad about not being able to buy his toilet paper, and how this lockdown is taking away his fundamental rights as a citizen. And at the same time, other people were saying that we have 80,000 people who have 86,000 as of this morning who have lost their lives in the US. So how do you balance your fundamental rights as a citizen during normal times versus these unprecedented times now? And I think it is all about not taking the situation seriously, not understanding it enough. Sometimes I find not taking responsibility as well. I've had conversations with a young person from Nepal who told me that no, this is my it is my, nothing is going to happen to me. I'm young. Even if it's something going to happen, it's going to happen to older people. So why should I stay inside and not travel and all that? So I said, yes, you might be young, but what about older people? You can infect older people, and there'll be and so that's why it's important for you to be inside. And then she told me that no, I will not infect other people, because when I find out I got COVID, I'll stay indoors during that time. But then how do you know that you have COVID for at least for 5 days or more? You may not have any symptoms and you transfer. So I think there are lots of people in the US as well who would think like that initially, not take it seriously enough, and who are still not taking it seriously, I think, in different pockets. So, and one of the things to worry about is that why is the transmission still rising up right now? Even like, why is it not halting down to zero? I think it's because people do not take social distancing as seriously as they think they should. So there are basic practices which people need to follow. A large segment of people are following it, but some people are not following it. And the people who are not following it are continuing to spread it.
Right. So we've completely run out of time. I would love to take some final questions if anybody has, but I guess right now we don't have any questions. On that, I'll just leave it. I have a question, a very difficult one for both of you, because most of us can't understand what's with the toilet paper, Naresh.
I think kind of thinking that the virus is entering a different route.
No, I think some of it is to do with cultural norms as well. In India and parts of the Middle East and all that, where people have bidets in toilets, so people are used to water as a system, and so in the US, that a lot of people have never seen water as a usage for toilets. So that is one thing. So toilet paper is seen as an essential commodity. So initially, when people this whole idea of lockdown started, people rushed and then started hoarding on toilet papers everywhere, and then they thought that, okay, I can survive without basic things. I need toilet paper, and that showed really the bad side of human nature as well, because they didn't leave enough toilet paper for other folks who might need it, and there were some people who were like hoarding it for, I don't know, for 5 years or something. And whereas it was not that bad, the supplies would keep coming in as long as people just took what they need, or maybe stock it for 1 or 2 months rather than stocking it for 2 years. So that.
I seriously think that they probably must be thinking that, this is entering that route as well. What if the virus you probably have to wipe it down there?
So Naresh, what's your stock like? How many rolls of toilet paper do you have?
Maybe 20 or 30.
Did you hoard?
I didn't hoard it as much, and there was not much to hoard by the time I got it, because I didn't rush initially when I went. So I think my supplies are like, the way I've been shopping is that I go out every 15 days. I go out in 15 days. I go out when I run out of milk for my son mostly. So it is about 15 days.
Trust you to be serious on that question too. On that note, thank you so much, both of you, for joining us. It's been wonderful talking to you. Just both of you stay safe, and all the best for whatever you're doing. We'll see you back in Sikkim very soon. Thank you so much for joining us. And to our viewers.
Thank you so much, Karma, and thank you, Ashila, and thanks to all the people watching watching us from all over the Northeast and different parts. Thank you so much, everyone.
Yeah. And thank you to our viewers. Of course, you can write in to us. The comment box is still open for some time, and you can also email us. eastmojo.com is where you can go and get all the top stories from Northeast India. Do follow us, like us on social media. That's it.
And Karma, I have one final thing. Earlier, you asked me about what can I do for my state and for different people. One thing I would tell people, that anybody watching this, it's not just for the show. If you have any difficulties, any questions, anything that any way I can help, please reach out to me. You can find me on Facebook or nareshag@gmail.com. That's my email address. So I'm always willing to talk to or to help people in whichever way I can. So please feel free to do that.
Brilliant, Naresh. Thanks for that. And finally, eastmojo.com for all the top stories from the Northeast. Thanks for watching. We'll be back with more interesting stories on Calling Home.